Pancreatic cancer. The Near North Palliative Care Network is a nonprofit organization committed to providing compassionate, comprehensive support for individuals and families facing life-limiting illnesses. They offer palliative care aimed at enhancing patients' quality of life through emotional, physical, and spiritual support. Their services extend beyond patients to include caregiver relief and bereavement counseling, helping families cope with the profound challenges of serious illnesses. As a cornerstone of our community, the Near North Palliative Care Network's mission ensures that no one has to face these hardships alone. They also strive to educate the public and advocate for awareness around critical health issues. Today, pancreatic cancer is a topic of interest, one of the most aggressive and challenging cancers to detect. Pancreatic cancer often presents no symptoms in its early stages, contributing to its late diagnosis and high mortality rates. Worldwide, it ranks as one of the deadliest cancers, with a 5-year survival rate of just around 11%. In this presentation, we will explore the nature of pancreatic cancer, its causes, risk factors, symptoms, screening and diagnostic methods, treatment options, challenges that come with treatment, the burden of the condition in the community, what community members can do to help individuals near them with the disease, and resources for the support of patients and community members. Raising awareness is critical, especially for the Nipissing and Parry Sound districts, where accessible health education can make a significant difference in improving outcomes and saving lives. What is pancreatic cancer? Pancreatic cancer arises in the pancreas, a small but crucial organ located deep within the abdomen, just behind the stomach. The pancreas plays two vital roles in the body. Firstly is its exocrine function, which is responsible for producing enzymes that break down fats, proteins, and carbohydrates into nutrients the body can absorb for energy and repair. The second is its endocrine function, which is responsible for producing hormones such as insulin and glucagon to regulate blood sugar levels and store energy. Around 95% of pancreatic cancer cases originate in the exocrine cells, the one that produce digestive enzymes. This is called pancreatic adenocarcinoma. The less common type, originating in the hormone-producing endocrine cells, is known as pancreatic neuroendocrine tumors. The location of the pancreas, hidden deep in the abdomen, makes early detection difficult. Many pancreatic tumors grow without causing noticeable symptoms until they have already advanced. Additionally, the aggressive biology of pancreatic cancer means it spreads rapidly to nearby organs, often invading the immune system's ability to fight it off. The disease's impact on both digestion and hormone regulation underscores why pancreatic cancer is so devastating. By the time it is diagnosed, many patients face limited treatment options, highlighting the importance of early detection and awareness. What causes pancreatic cancer? Pancreatic cancer is primarily caused by mutations in the DNA of pancreatic cells, leading to uncontrolled cell growth and tumor formation. These mutations can be hereditary, meaning it is passed down through families, involving mutations in genes responsible for tumor suppression or DNA repair. Conditions such as BRCA1, BRCA2 mutations, and Lynch syndrome can increase susceptibility. These mutations can also be acquired, which can occur during a person's lifetime, often due to environmental exposures or chronic conditions. Smoking, chemical exposure, and chronic pancreatitis are common contributors. Chronic inflammation in the pancreas plays a significant role in triggering these mutations. In some cases, an autoimmune condition like autoimmune pancreatitis can also elevate risk. Researchers are investigating the links between lifestyle factors, inflammation, and genetic predispositions. While the exact causes are still under study and unknown, identifying risk factors and understanding the mechanisms can guide prevention efforts and targeted screening. What are the risk factors for pancreatic cancer? Several factors increase the likelihood of developing pancreatic cancer, including being overweight. Specifically, excess body fat, particularly around the abdomen, is linked to higher inflammation and insulin resistance, increasing risk. Age. The risk rises sharply after age 60, with most cases diagnosed in individuals over 65. Smoking. Smoking is a leading preventable risk factor, responsible for approximately 25% of pancreatic cancer cases. A history of diabetes, type 2 particularly, when newly diagnosed, may signal underlying pancreatic cancer. The relationship between diabetes and pancreatic cancer is bidirectional, meaning diabetes can be both a cause and an early warning sign. A history of chronic pancreatitis can also be a risk factor as the long-term inflammation significantly elevates risk, especially in individuals with a heavy history of alcohol use or gallstones. A family history of pancreatic cancer or genetic syndromes, such as FAM syndrome or MEN1, increases vulnerability. Diet and lifestyle is also highly important. Diets high in red and processed meats, low in fruits and vegetables, and sedentary lifestyles contribute to overall cancer risk. While we cannot control factors such as age or genetics, modifiable risk factors such as quitting smoking, maintaining a healthy weight, and following a balanced diet can significantly lower the risk. Recent advancements in genetic testing and family history analysis are helping to identify high-risk individuals who may benefit from early screening, improving the chances of early detection. Symptoms of pancreatic cancer. Pancreatic cancer symptoms are subtle and often mistaken for other conditions. Common signs include fatigue, unexplained weight loss and appetite loss, abdominal and back pain that worsens after eating or lying down, digestive problems such as pale, light-colored stools that float, which can indicate the pancreas is not producing enough enzymes to digest fats properly. Dark urine, which is caused by an accumulation of bilirubin due to bile duct obstruction. Jaundice, which is the yellowing of the skin and eyes, which is often one of the first noticeable symptoms. And new onset diabetes. These symptoms can often appear when the cancer has already spread, making early intervention critical.
We will now explore how pancreatic cancer is diagnosed. There isn't a screening test that can be used by the general public for pancreatic cancer yet. However, individuals that are at a high risk because they have a family history of the disease or have conditions like pancreatic cysts that put them at a higher risk, these individuals can take certain screening tests to detect the potential presence of the disease. So for people who have family members that have the disease, these would be their first degree relatives like parents, siblings, or children. They can get genetic testing done. Genetic testing usually involves taking a blood sample and then looking at potential mutations in a person's DNA that can cause the disease. For pancreatic cancer, there aren't any specific gene mutations that causes the cancer, but there are gene mutations that increases a person's risk of getting pancreatic cancer, which is what a healthcare provider would look for through genetic testing. These mutations can include the BRCA2 gene mutation, which increases the risk for breast cancer, ovarian cancer, as well as pancreatic cancer. There can also be a mutation in one of the 4 mismatch repair proteins that we have. These proteins fix mistakes in DNA sequencing when DNA is being copied. Mutation in these genes result in a genetic disorder that's known as Lynch syndrome, which increases the risk of developing many cancers, including pancreatic cancer. Lastly, there can be a mutation in the PRSS1 gene, which leads to hereditary pancreatitis, which is a genetic disorder that causes inflammation in the pancreas, and it increases the risk of pancreatic cancer. For individuals with pancreatic cysts, which are fluid-filled sacs that grow in the pancreas and can then further grow into cancer, imaging can be used to detect these masses. And if growth is seen, then further diagnosis can happen. Now we will look at some diagnostic methods for pancreatic cancer. There can be imaging tests that provide visual information about the pancreas and the surrounding tissues. So these can include abdominal ultrasound, which uses sound waves to produce images of organs inside the abdomen and can detect abnormal growth within some parts of the pancreas. An ultrasound can't be used to provide a confident diagnosis because it doesn't do a good job of visualizing all parts of the pancreas, and it can miss presence of tumor in certain parts. It's mostly used to see a general picture of the abdomen and rule out other conditions. An ultrasound test that does a better job at detecting pancreatic tumors is called endoscopic ultrasound. It involves inserting a thin tube called an endoscope through the mouth into the small intestine or the stomach, where it can create pictures of the pancreas, bile ducts, helping detect the presence of cancer. Another imaging test that can be used is a CT scan, which uses x-rays to create clearer pictures of the pancreas and is often used for diagnosis because it allows to see the spread, the size, and the location of the tumor. For detection of small tumors, the more detailed pictures are required, which is when an MRI scan is used. It uses radio waves and magnets to create detailed pictures of the pancreas, bile ducts, and blood vessels. There's also cholangiopancreatography, also known as ERCP, which is a procedure used to look at pancreatic ducts and bile ducts to see if there is any blockage, dilation, or narrowing present. It involves inserting a thin tube, again called an endoscope, in the first part of the small intestine, and then an X-ray is taken of the bile ducts to detect any blockage. It's usually used when there is unexplained yellowing of the skin and eyes. This condition is called jaundice, which is a common symptom of pancreatic cancer, as mentioned above. Lastly, a PET scan can be used to detect the possible spread of pancreatic cancer. It involves being injected with a radioactive form of sugar that collects mainly in cancer cells, and then a picture of areas of radioactivity in the body is created through a special camera. Other than imaging tests, blood tests and biopsy can be used to diagnose pancreatic cancer. Blood testing can involve liver function tests, which are done to figure out if a patient's jaundice is due to a disease in the liver itself or if it's caused by a blockage of bile flow due to the presence of something like a tumor. This is done by looking at levels of bilirubin, which is a chemical made by the liver. There are also tumor markers, which are substances found in the blood when a person has cancer. So a high level of these will indicate presence of potential cancers like pancreatic cancer. These tumor markers are the CA19-9 and CEE. It is important to notice that since levels of these tumor markers are high for many diseases, these can't be used to confidently say that someone has pancreatic cancer. Lastly, a biopsy can be also done for diagnosis, which involves removing samples of the mass and looking at it under a microscope to detect potential abnormal cancerous cells within the tissue. A biopsy can be percutaneous, which involves inserting a needle through the skin to remove a small piece of a tumor. It can also be endoscopic, which involves using an endoscope to collect a sample of the tumor. This is done during the two imaging tests that use an endoscope to create pictures of the pancreas, which are endoscopic ultrasound and ERCP, as mentioned above. For endoscopic ultrasound, there's a needle attached to the endoscope, which can be passed into the tumor, and that allows collection of the sample. For ERCP imaging test, a brush is used instead of a needle to collect cells from the tumor. Biopsy can also be surgical, which is less common and involves removing tissue from the mass through surgery and examining it under a microscope. Now we will explore some of the treatments for pancreatic cancer. The type of the treatment used depends on whether or not the tumor is resectable, meaning removable through surgery. If the cancer is removable through surgery, then surgery is performed, and the type of surgery depends on where the cancer is located. If the cancer is located on the head of the pancreas, then a Whipple procedure is performed, which removes the cancerous head of the pancreas. If the cancer is located in the body and the tail of the pancreas, then distal pancreatectomy is performed. If the tumor is removable but there are high-risk features like it being large, then chemotherapy is given before surgery to shrink it in size. Chemotherapy involves using drugs to kill or stop the growth of cancer cells. And also after removal, if there is a high risk of cancer coming back, and then chemotherapy or radiation is given. Radiation means using beams of intense energy to kill the cancer cells. If the cancer has grown into the surrounding blood vessels or tissue, then it becomes harder to remove through surgery and requires a more complex surgery. Such cancers are referred to as borderline resectable cancers. For these, usually chemotherapy is given first to shrink the cancer in size, and then imaging tests can also be done to see the growth of the cancer. When the growth is reduced, then surgery is usually performed. There are also non-resectable cancers, meaning cancers that can't be removed by surgery, so chemotherapy and radiation are used to shrink the pancreatic cancer to allow people to live longer. There can also be palliative therapies that can improve the patient's quality of life by controlling symptoms of pancreatic cancer. These include palliative radiation, which uses radiation to relieve symptoms associated with cancer, palliative surgery, in which the goal is to perform surgery to relieve symptoms of pancreatic cancer, and injections of medicine to relieve the pain.
Pancreatic cancer is one of the most dangerous forms of cancer. The lack of a universal or specific form of screening for pancreatic cancer makes it even more dangerous. Often, blood tests, imaging, or biopsies are only performed once symptoms arise, which is a major challenge because the disease commonly goes undetected until it reaches the advanced stage. In fact, approximately 60% of cases are diagnosed after the cancer has already metastasized, significantly limiting treatment options. When pancreatic cancer has metastasized, this basically means that the cancer cells that originally formed in the pancreas have moved beyond this area within the body and onto other organs, usually with the liver and lungs being the first to be affected. The prognosis of pancreatic cancer depends heavily on the stage at diagnosis. Sadly, only 15 to 20% of pancreatic tumors can be surgically removed, and even with early diagnosis and treatment, only 10% of patients achieve disease-free status. This contributes to the low overall survival rate. Pancreatic cancer has a survival rate of only 5 years, with just 12% of individuals who are diagnosed surviving after the 5-year mark. The high mortality rate is partially due to the pancreas's location in the body. The pancreas is hidden behind multiple organs such as the stomach, small intestine, liver, gallbladder, spleen, and bile duct, making early detection difficult. These statistics emphasize the urgent need for better screening methods and increased awareness to improve early diagnosis and survival outcomes. Early detection of pancreatic cancer is uncommon, but when it does happen, it's often due to the tumor's location on the pancreas causing noticeable symptoms, or it was discovered accidentally during tests for unrelated medical conditions. Catching pancreatic cancer at an early stage can lead to significantly better health and survival outcomes. With early detection, patients have access to more treatment options such as chemotherapy and radiation, and may even be eligible for surgery. Surgery, in particular, offers the best chance for higher survival rates, but that's only if the cancer is within the early stages. At this stage, the cancer is less likely to have spread to other organs, which increases the effectiveness of treatment. Additionally, early detection helps reduce the financial burden associated with pancreatic cancer. It leads to lower healthcare costs by avoiding more intensive late-stage treatments. Overall, the benefits of early detection cannot be overstated. It saves lives, provides more hope for recovery, and reduces the strain on both patients and the healthcare system. Now on to pancreatic cancer statistics within the country. In Canada, pancreatic cancer is the third leading cause of cancer death in the country, despite only being the 11th most commonly diagnosed cancer type. The Canadian Cancer Society predicted that in 2024, an estimated 7,100 Canadians will be diagnosed with pancreatic cancer, and sadly, an estimated 6,100 Canadians will die from the disease. One critical factor affecting outcomes is socioeconomic status. Individuals with low socioeconomic status face significant challenges, including an 18% higher risk of death from pancreatic cancer. They are less likely to undergo surgery, which is the best option for increasing survival rates, and may not receive appropriate therapies based on their cancer stage. This disparity highlights how systemic factors can limit access to life-saving treatments. Pancreatic cancer's high mortality, combined with these inequities, emphasize the urgent need for improved detection methods, equitable healthcare access, and public awareness to help reduce the burden of this disease. Pancreatic cancer is a serious health concern in Canada, and its prevalence is projected to rise significantly over the years. Looking at data composed by Fluke and Zanton in the table below, in 2009, there is a clear upward trend in the total number of cases across all age groups from 2006 all the way to the year 2031. In 2006, there were approximately 2,636 cases. By 2021, this number nearly doubled, reaching 4,469 cases. Projections for the year of 2031 estimate a staggering 5,619 cases, a sharp increase of over 2,900 cases compared to 2006. Breaking it down by age groups, the most significant increases occur in older populations. For instance, individuals aged 75 to 79 saw an increase from 600 cases in 2006 to an estimated 1,257 by 2031. Similarly, in the 80 to 84 age group, cases are projected to be more than double, rising from 509 in 2006 to 1,063 in 2031. These trends are likely driven by Canada's aging population, as the risk of pancreatic cancer increases with age. While the 50 to 54 age group shows relatively stable numbers over the years, it's clear that older age groups account for the majority of the rising cases. For example, it can be seen that there is a large jump from the 60 to 64 age group to the 65 to 69 age group, starting from 2016 and into future estimates. If you remember back to the risk factors of pancreatic cancer, being over 65 is one of them, which may explain these trends. This data highlights the importance of early detection and prevention strategies, especially as we face an aging population and growing healthcare challenges related to pancreatic cancer. The Nipissing-Parry Sound District is located in the northeastern region of Ontario, as shown in the map on the right. It falls under the jurisdiction of the North Bay Parry Sound District Public Health Unit. Like many regions within Ontario, this district faces significant challenges when it comes to pancreatic cancer, a disease known for its high mortality rate and poor prognosis. When we talk about the prevalence of pancreatic cancer, we're referring to both new and existing cases diagnosed within a specific time period. Prevalence helps us understand the overall burden of this disease in the population, including the demand for healthcare resources and the ongoing challenges faced by the patients and their families. On the other hand, the mortality rate measures the number of deaths attributed to pancreatic cancer during a specific time frame. Monitoring these rates within the Nipissing-Parry Sound District is essential to identifying trends, assessing the effectiveness of interventions, and advocating for more targeted healthcare strategies in the region. Addressing these issues requires collaboration between healthcare providers, researchers, and the community to improve early detection, treatment access, and support systems for those affected. In 2020, data from an Ontario Health report highlighted the prevalence of pancreatic cancer in a population of 130,276 people. The map revealed the percentage and number of males and females of all ages who were diagnosed with pancreatic cancer and were still alive in 2020 that year. the overall prevalence rate for the general population was 0.036%, or 45 cases per 100,000 people in 2020 alone. As you can see on the map to the right, the North Bay Parry Sound District Health Unit is the darkest shade of red. This indicates that this district has one of the highest prevalence of pancreatic cancer. There is also important data not shown on this map relating to the age risk factor for pancreatic cancer. For individuals aged 60 to 69 years in the Nipissing Sound Parry District, the prevalence rate was higher at 0.071%. This translates to 15 cases per 100,000 people in this age group, based on a population of 21,024 individuals. These statistics underscore the importance of understanding how pancreatic cancer affects different demographics. Older adults, particularly those aged 60 to 69, experience a higher prevalence, which emphasizes the need for targeted prevention. Monitoring these trends helps public health officials allocate resources effectively and address the specific needs of at-risk populations. From 2016 to 2020, the number of deaths caused by pancreatic cancer was mapped for a population of 643,404 people within the Nipissing and Parry Sound District. During this period, the mortality rate was 13.5 deaths per 100,000 people for males and females of all ages, a reminder of the disease's significant impact. The map and legend show that the North Bay Parry Sound District is the second darkest shade with a mortality rate between 13.2 to 14.1 per 100,000 people. This district falls in the second largest section with the highest mortality rates for pancreatic cancer. What wasn't shown on the map was how this mortality rate increased dramatically among older adults. For those aged 60 to 69 years, the rate rose to 13.4 deaths per 100,000 people over the same time frame of 2016 to 2020. This age group had a smaller population of 100,228 people, but the higher mortality highlights the increased vulnerability of this demographic. With pancreatic cancer often being diagnosed at the late stages, focusing on at-risk groups, particularly older adults, is essential to reducing mortality rates. That is why it is important to understand these statistics and what these measures of health, such as prevalence and mortality, indicate. At Near North Palliative Care Center, this is exactly what they aim to do. They recognize the burden of pancreatic cancer on older populations and help them receive the care and support people deserve.
Pancreatic cancer is a serious and often under-recognized disease that impacts not only the physical health but also mental and emotional well-being. In this presentation, I want to highlight how we can all make a meaningful difference in supporting individuals around us who may be living with this challenging condition. By raising awareness, fostering early detection, engaging in community efforts, and promoting healthier lifestyles, we can create a supportive environment that empowers individuals to face this disease with strength and hope. Let's start by understanding the profound impact of pancreatic cancer. Beyond the physical challenges, such as pain and fatigue, it also brings significant emotional and psychological burdens. Patients often face feelings of anxiety, fear, and isolation. By raising awareness in our communities, we can help reduce the stigma surrounding pancreatic cancer. This simple act of empathy and understanding can make a world of difference, allowing individuals to feel supported rather than alone in this journey. Early detection is critical when it comes to pancreatic cancer. Recognizing symptoms like jaundice, unexplained weight loss, or persistent abdominal pain can lead to earlier diagnosis and better treatment outcomes. However, many people are unaware of these warning signs. By encouraging our friends, families, and communities to stay informed and proactive about their health, we can play a significant role in improving survivor rates by reminding everyone of the importance of regular checkups, seeking medical advice when unusual symptoms arise. We also have the opportunity to make a direct impact by participating in community efforts, such as volunteering with organizations like the Near North Palliative Care Network, allows us to contribute to campaigns that raise awareness and provide resources for those affected by the disease. Community involvement reduces isolation for patients and shows them that they're not facing this battle alone. Also, adopting healthy habits like eating a balanced diet, staying physically active, and avoiding harmful behaviors such as smoking can lower the risk of pancreatic cancer and other chronic diseases. These lifestyle choices not only improve our physical health but also boost mental well being, giving us more resilience to handle life's challenges. As a community, we can promote these habits and inspire one another to prioritize health. In conclusion, there are so many ways we can support individuals with pancreatic cancer, from understanding their struggles and advocating for early detection to joining community campaigns and encouraging healthier lifestyles. Every small action makes a difference. Together, we can create a supportive network that uplifts those affected by this disease and builds a healthier future for everyone. As community members, we play an important role in supporting individuals and families impacted by pancreatic cancer. I would like to focus on key resources available to help us foster a more informed, connected, and supportive community, whether through educational platforms, training programs, or support networks. These resources empower us to make a tangible difference in the lives of those affected. One essential resource is the educational platforms offered by the Near North Palliative Care Network. Through their YouTube channel and Talent LMS platform, NNPCN provides accessible, reliable information on chronic disease management and palliative care. These resources are invaluable not only for individuals affected by the disease but also for volunteers and caregivers who want to improve their understanding of chronic illnesses. By using these platforms, community members can gain the knowledge needed to better support patients and their families. Another significant resource is NNPCN's volunteer training programs. These specialized training sessions equip volunteers with essential caregiving skills and a deeper understanding of disease progression. This is particularly beneficial for those working with aging populations, as it helps address their unique needs and challenges. By participating in these programs, volunteers become a critical part of the support system, bridging the gap between patients, their families, and professional healthcare providers. Lastly, support networks and community programs are indispensable in fostering a sense of belonging and understanding. These programs connect families, volunteers, and professionals, creating a mutual support system. They also offer emotional support and opportunities for knowledge sharing, which is important for patients and caregivers navigating the complexities of pancreatic cancer. By participating in these networks, community members can help reduce isolation and build resilience among those affected. In conclusion, these resources, educational platforms, volunteering training programs, and support networks are important for empowering community members to offer meaningful support. By leveraging these tools, we can create a strong, more informed community that not only uplifts individuals impacted by pancreatic cancer, but also works together to provide a foundation of care and compassion. Taking advantage of these resources makes a real difference. Living with pancreatic cancer can be overwhelming, but numerous resources are available to help patients navigate their journey with greater ease and support. There are essential resources designed to address the physical, emotional, and informational needs for patients. These tools aim to enhance their quality of life, provide reliable information, and create a foundation of support for patients and their families. Let's begin with palliative care, which plays a critical role in improving the quality of life for individuals facing advanced stages of pancreatic cancer. Palliative care focuses on long-term symptom relief, helping patients manage pain, fatigue, and other physical symptoms. These services not only address the patient's need, but also provide vital support for families, helping them navigate emotional and practical aspects of caregiving. Organizations like the Near North Palliative Care Network offer accessible palliative care services ensuring that patients receive compassionate, personalized care during difficult times. Next, let's discuss the importance of mental health support. A cancer diagnosis can lead to anxiety, depression, and feeling of isolation. Counseling services, available both in person and online, provide patients with a safe space to express their concerns and find coping mechanisms. These services are essential for addressing the emotional and psychological burdens of living with chronic illnesses. Organizations like Gildas Club Greater Toronto offer free group therapy sessions, workshops, and individual counseling, creating a network of emotional support tailored to patients' needs. In today's digital world, access to accurate and evidence-based information is important. The Near North Palliative Care Network's website and YouTube channel provides reliable resources on disease management, treatment options, and coping strategies. These platforms empower patients to make informed decisions about their care while dispelling myth and misinformation that can sometimes create unnecessary fear or confusion. Lastly, Canada's Health Gateway serves as a government-backed resource that connects patients to essential tools and services. This platform offers access to health records, disease prevention information, and other evidence-based health tools. Patients can use it to manage their health needs, find appropriate support services, and stay informed about new developments in treatment and care. By leveraging these digital resources, patients gain greater control over their healthcare journey, fostering confidence and independence. In summary, the resources available for patients, ranging from palliative care and mental health counseling to trusted information platforms and government-backed tools, are designed to provide comprehensive support. Together, these services address the physical, emotional, and practical challenges faced by individuals living with pancreatic cancer. By connecting patients to these resources, we can help them lead a more empowered and fulfilling lives, even in the face of such a challenging diagnosis.